Welcome to Samba Samba. Enjoy the video.
You begin by focusing on essentials you must already know: common routes, typical doses, and indications. First, create a concise drug card for each medication. Include dose ranges, onset, peak, and key side effects. Once done, prioritize high-risk agents like insulin and anticoagulants so you learn them first. Make sure to use a calculator and a reliable reference app while you practice calculations and conversions, because accuracy now prevents errors later. Now you move into targeted practice and integration. Use spaced repetition to lock in mechanisms, contraindications, and monitoring parameters. This explains why some meds require labs or extra checks. Then practice calculations until comfortable, convert mg to milliliters, calculate infusion rates, and time Roman 4 pushes. Once confident, run simulated scenarios aloud, decide titration steps and PRN criteria. These steps build speed and judgment, so you can apply knowledge in real patient care. Finally, consolidate with active recall and application. Teach back medication plans to appear or use flashcards and quick quizzes. This reveals gaps and strengthens memory. Then practice at the bedside. Always confirm the 5 rights, check allergies, and set monitoring parameters. If something goes wrong, troubleshoot systematically, recheck your math, review transcription and orders, and question assumptions about doses or patient factors. Make sure to document the correction and learn from.
Thanks for watching. Consider subscribing if we helped you.